a lot of big hospitals. So we had a really good training from a lot of orthopedics as well as podiatrist. And so my specialty is foot and ankle. I enjoy doing a lot of foot and ankle, of course. After residency, I made a choice to come back and practice with my father. My father's been in practice probably for over 30 years now. He's had an office here in Brigham City. So he's getting close to retire this year. And so we thought we'd go out with a bang, and we're actually headed to Africa at the end of this week, and we're gonna go do surgery on a bunch of kids that had neglected clubfoot, and we'll be there for about 10 days, and so there's a couple specialists there that we'll be helping out a lot of these kids. And so just a good opportunity before he retires, and thought we'd do something kind of fun. So we're trying to get ready for all that this end of this week. So in foot and ankle, what we see in our office commonly. A gentleman here just mentioned plantar fasciitis. You know, we commonly see plantar fasciitis come in to our office. What that simply is heel pain. There's a fibrous ligament tissue that attaches from the ball of your foot to the heel bone, and people commonly complain of first step in the morning pain, pain in their heel after on their feet for a long period of time. It's a pain that comes and goes and gets worse as you do more activity. People have a hard time of it getting away. And I see in people that lose or gain weight quick in a short period of time. I see it in pregnant women because of the relaxin that kicks in. Their feet change and they start to get a lot of heel pain. I see it in a lot of runners. Then I see it in people on their feet all day working. It's common to see in a lot of these types of individuals. And it can be very painful. First step in the morning is the most common classic symptom. I get out of bed and it hurts right when I step down. And so that's a common symptom that you usually see with that. Another thing that I usually see in my office, I see a lot of ingrown toenails. You know, a common outpatient surgery we do is just a quick ingrown toenail procedure that comes in, and they have an infected toe because the shoe's been too tight or rubbing because they've been running, or for whatever reason, just sometimes it's the way the nail structure is. It's irritated against the offending nail border of skin, and it starts getting infected, and it gets pussy and can get gross and then get cellulitis. It can be pretty serious. I have seen an infected nail get septic. So surprisingly enough, sepsis means they'll get blood poisoning from the infection in their ingrown toenail. I have seen that. Yes, there's one question.
Ingrown toenails from cutting your toenails too short?
Very good question. Yes, you can get ingrown toenails from cutting it too short, because the way it grows out, it'll hit the offending nail skin, and it can really irritate it. And that's why we kind of suggest just to kind of cut it straight across as best you can, and do not cut it too short. All right, just take a little bit off. Shouldn't curve it unless it's already ingrown. If it's already ingrown or already digging into the corner, you can cut it back a little bit just to kind of get relief until you can get in the doctor's office. But as best as possible, yes, just kind of cut it straight across and don't cut it too short. So there's a simple procedure we just do in our office. We numb you up, we take that offending nail border out, and then we use a chemical, and that chemical is about 90% effective to not let that nail grow back. And we usually have a pretty good success rate. There's a 10% window, but most people do pretty good with those results for a small procedure. It doesn't hurt a lot. People take a little bit of ibuprofen, Tylenol afterward if it is painful. If it's been going on for a long time and it's infected, then yes, it's a little bit more painful, but most of the time people tolerate it fine with a little pain with a good success rate. Again, it can be serious. If the cellulitis gets bad, it can go septic. So I have seen stuff like that. Another common thing is we see injuries. We see injuries that come in our office. I see people that fall. I see people that jump off things. I see people that step on stuff. I see things that people that trip. I see people, all sorts of injuries, runners, car accidents to accidents at work, stuff fall on people's feet and crush injuries. And so I work closely with the emergency room, and I do see stuff come in from that as well. Stuff get referred directly to my office. But those are kind of the exciting stuff. That's what I enjoy doing a little bit of a little bit more of the trauma. They're a little bit, it's a little bit more involved and entails usually required some kind of surgical intervention most of the time if it's pretty serious. We do see the regular fractures, fracture care and breaks, and do casts and splints and bracing and stuff like that in our office a lot to those that do have stuff. Other things we see, sometimes there can be corns, hammer toes, bunions, all these things probably people have heard of, don't know exactly what they are at times, but simply it's something that happens to the toes. Sometimes when your toes curl up or bend, and that's what it is when your toes bend, there's two tendons, one tendon on the top and one tendon on the bottom of each of that toe. And it's kind of a balancing act. And if that balance isn't equal, and then you'll start to get a little bit of a deformity that forms. One tendon overpowers the other, and it starts to contract. And that contracture is what's called a hammer toe. And what's the problem with hammer toes is that simply it can rub against the shoe. It can rub against the shoe, it can irritate it, it can cause a corn or a sore or a start of infection as well. And so it's very important if you see one of those that's starting to irritate the toe to either change shoe gear and try to get a softer material on the top of the shoe or try to pad it. Some people put a little pad over it to make sure it doesn't rub or irritate, or sometimes to kind of fix the problem if it becomes bad enough, sometimes we have to surgically correct it to straighten it out. Another thing that people have is what's called a bunion. You can get a bunion on the big toe and you get a tailor's bunion on the outside part of on the little toe. And those bunions also as well can cause a lot of problems. I don't like the word bunion because it simply doesn't describe kind of what's going on with the foot or the structure of the foot. But simply what's happening is that one of the joints in your big toe called your metatarsal phalangeal joint is becoming dislocated to where one of the bones is going one direction and the other bone's going the other direction. And so you can kind of see on your foot on the inside that there's a bump on the inside part of your foot or a bump on the outside part of your foot. One of the bone is protruding. And that can become prominent, it become painful, it can become painful in shoe gear, and it can start to give you trouble to where it causes sores, it causes pain every time you walk. And people complain a lot of a callus that's formed, and it just becomes painful to consistently move on it. So those are the things you kind of want to watch out for.
So is it true if you have a lot of feet problems that it causes you to walk funny and it can actually damage your knees also?
That's a very good question. Yes, that's very true. And so that's why it's important when we take x-rays in our office and we look for deformities that are present, like the hammer toes or bunions or a midfoot arthritis or a flat foot or a high arch type foot. We look in our office at the x-rays and try to make sure there's a good alignment all around at each of the joints, because your gait is definitely affected by what is going on in your feet. And for example, if you have a bunion, that bunion during propulsion, which is the last phase of the gait cycle, when you push off with your big toe, as you push off with your big toe, you should get 60% of that motion going through that toe. When you have a bunion, it's restricted and stopped because the joints aren't aligned how they should be, and so it shifts direction. And when it shifts direction, that changes the biomechanics in your midfoot, in your rear foot, and your knees and hips up the road. And so sometimes what we do is we have an insole. I say an insole, but sometimes we have a small little thing called an orthotic that actually goes in the shoe. It kind of looks similar like this. There's hundreds of styles of different orthotics. And we have an orthotic that goes in the shoe that are kind of like glasses. They simply, glasses help you see better. Orthotics in your shoes kind of help you walk better. So they change your gait, especially where we can correct. There's a custom-made orthotic and over-the-counter orthotic. And the custom-made orthotic, it can be customized to your foot and what you have going on specifically. And so we can make a custom-made orthotic, accommodate for what you have to the way you're supposed to walk to make it not so it affects your knees, hips, and your back, your lower back that you mostly see for a lot of people. Have people come in with a lot of knee pain, even lower back pain, even until you just get orthotics, because it does make a significant difference on the way your foot structure is and the way what's going on. So that's just kind of an idea. I do see a lot of ankle stuff that comes in my office. I see a lot of ankle sprains, sports injuries from people playing basketball or football or any athletic event. So even kids that come in are involved in a lot of sports. I do see them. Commonly, ankle sprains, high ankle sprains is very common. An ankle is a very important joint. And you don't appreciate it until you actually have pain in it. And once you have pain in it, then you appreciate these joints and what they do and the function of how they work. But your ankle joint is what's called a ball and socket joint. And it's simply the fact that it has a tibia on it and a talus, and it kind of rotates and moves. And the structure of that is very important. There's ligaments on both sides of the ankle. And after a lot of ankle sprains, people get what's called chronic ankle instability, where it just continues to give out, or they continue to sprain their ankle. Even on flat ground or just walking around, their ankle will kind of give out, and they'll lose the structure of their ankle. And so they can, and most likely that's because they've torn a ligament on the outside somehow, playing athletics or doing whatever it is. And they come in complaining that it just continues to give out. We have to get an MRI usually and look at that ligament. And if that ligament is torn over 50%, then it has to be surgically corrected. If it's under 50%, usually we can do a little therapy, brace, do a few things conservatively to get it better. But we usually can't fix those now through an ankle scope, which is nice because a lot of people used to not be able to do that. So the techniques have changed. They are a lot better. You know, there is angle stabilizations that can be done through an ankle scope, which is a huge improvement compared to how the technology was several years ago. Another thing that I do see is I see a lot of shin splints in runners. I see a lot of Achilles tendon pathology. So people get a lot of Achilles tendonitis. Some people get a bone spur. Sometimes ladies that wear high heels get pump bumps, it's called. They wear a lot of high heels. It irritates their Achilles tendon. They get a prominence on the back of their heel. And it's not on the bottom of the heel, but it's more posteriorly or on the back of the heel. And they can get a significant spur back there due to that, due to the rubbing of the shoes, due to activity, due to medication, due to your past medical history. There can be a lot of reasons that can be caused from. But that Achilles tendonitis or retrocalcaneal exostosis can be very painful on the back part. It's just kind of a spur that forms on the back part of that heel. And what becomes so painful is that spur is going into the Achilles tendon and digging every time that Achilles tendon moves, or every time you walk, or anytime you wear a shoe, it rubs against the back of that heel. And it can rub against that spur and then cause it to aggravate. And so that becomes very painful for a lot of people. Physical therapy does help that a lot. Stretching does make a big difference for that. But a lot of times I do end up doing a lot of surgical intervention on those to get rid of the bone spur. Another thing I see for people, just being on their feet a lot, feet fatigue. Surprisingly enough, people that work 6 to 12 hours on their feet, it can be incredibly painful. Most people get by 4 to 6 hours without having a significant amount of pain. If you're having pain after that or before that, after that is usually normal to some degree. Before that, you should be able to get by, at least 4 to 6 hours without having any pain, no matter what age you're at. If you're having a lot of that pain, sometimes we have to take a closer look. Sometimes there can be an underlying deformity, underlying pathology, or underlying issue going on before we can really decide on what is best to need or what is best that you need. Most of the time, if that's the case, people just need different types of shoes, different types of insoles that go in your shoes that can make a big difference. Again, the orthotics. These are called orthotics. There's over-the-counter orthotics and custom-made orthotics. The over-the-counter ones, there's some at Walmart that you'll see that you'll step on a little machine and they'll give you kind of a rundown of just what type of over-the-counter orthotics you need. It's not as good. It's not quite as good of a machine as most doctors have. And so I probably recommend just staying away from those. There is a Dr. Gel or a Dr. Scholl's ones that's actually not too bad over the counter. There's two types of over the counter that I usually recommend to a lot of people. One is called a Power Step orthotic, and another one is called Super Feet. Those two are just really quality made over the counter orthotics that usually do a pretty good job for most people that are just having generalized foot pain. And an over the counter one should last 9 months to a year. After that time, with the mileage you put on, for most people, you need to get a new orthotic or keep getting a new over-the-counter orthotic every 9 to 12 months. These custom-made orthotics last 3 to 5 years. And that's what's best. That's what's great about the custom-made orthotics is just they last a little bit longer, they do a little bit better job, and they're customized to your foot. And so I can change it, I can modify it, I can do stuff the way I want to what you have, to the way your foot structure is. People have a lot of flat feet or have a lot of high arches. And those are the two most common type of feet that usually come in my office, are the flat feet as well as the high arches. There is, surprisingly enough, something in between. But the custom-made orthotics really accommodate for people that have these kind of deformities and really make a big difference long-term to prevent symptoms down the road. I do see an incredibly amount of symptoms and pain that comes from people with either flat feet or a very, very high arch. How can you tell specifically if you have a high arch or flat feet? It's really hard to tell. Sometimes it's really obvious if it's a severe deformity. If it's a mild or moderate deformity, you usually have to get an x-ray really to tell. You have to get an x-ray really to tell. But here's how flat feet looks. They almost walk like a pigeon a little bit. So their feet point outward like this, and they kind of walk kind of at an outward appearance. And you'll see people with really bad flat feet kind of walking with that kind of gait. And when you know you walk a little bit like that, it has probably gotten to the severe point where you really need to come in and make an appointment. High arches. People with very, very high arches walk a little bit more on the outside part of your feet. And so you walk and you wear your shoe on the outside part, and that's how you know most likely you probably have a really high arch and you're walking on the outside part of your foot. Your foot goes into a little bit of a different position called a varus position, and that's when you walk on the outside part of your foot. What do we do about those? Simply, we've come a long way as far as medicine goes in the way we handle these. We try to catch them. The most common one, of course, is flat feet. Flat feet is the most common. It's by far the one I see probably 6 out of 10 times that come to my office. Maybe high arches are less common. You don't see them as often. But we'll try to catch flat feet even as little as 3 months now, because they found that if we can cast them early, then we don't have to end up doing a huge reconstruction later on down in life. And so flat feet, we like to cast them even at a young age to try to prevent prevent serious problems down the road and help correct the structure of their foot as they continue to grow. We do bracing for them. We give them an insole, even as a little kid. When they start to walk, they start to get insoles that go in their shoes to help make a big difference while they're moldable or still manipulated, are able to manipulate it a little bit in order to kind of correct what they have at a young age. Usually by the age of 3, their bones start to sit where they're going to be. And that's why it's important that we kind of catch it at an early age so people don't have to mess around with a lot of the problems that they have later on in life. It's kind of like clubfoot. That's what we're going to do now. Clubfoot, we have a new technique called a Ponseti technique that you cast and put them in early, right, detecting from after they're born. And there's bracing at night that we do that can save a lot of problems of the way their foot is aligned and the functionality of the way they're going to get around with their gait. And so Clubfoot, flat feet, some of these other things with kids are very important to catch why they're early or get evaluated why they're early. Flat feet, the most common symptom later on in life that we see is people have pain in their arch, kind of in the inside part of their ankle. On the inside part of their ankle, there's a tendon called your posterior tibial tendon, and that tendon comes down around the inside part of your ankle and attaches to a bone in your foot called the navicular bone. That tendon attaches to actually every bone in your foot, and the navicular bone is the main attachment to where that tendon attaches to. But it's a very important tendon because that holds the bone structure up in your foot to give it the support enough to maintain the arch. So if that foot is collapsing, then you usually know that tendon's either torn or not functioning properly. And it's called posterior tibial tendonitis. And it's commonly seen. Some people call it flat foot, some people call it pes plano valgus, some people call it posterior tibial dysfunction. There's a bunch of different names for it, but the simple name is just flat feet for most people, so we can remember how it is. What we do is we have to see what stage they're in. We kind of stage it out as a physician, and once they're in different stages, we know the different treatment for it. If it's an early stage and the foot hasn't completely collapsed, then you can choose bracing, you can choose orthotics, you can choose different things conservative-wise that will help make a big difference. If it's got to the point where it's really severe and that tendon's ruptured, you pretty much have no choice but to go under surgical intervention to kind of correct it. So catching stuff early is very important, especially in flat feet as well as high arches or cavus foot. High arch with cavus foot, most people complain of ankles, sprained ankles, a lot of sprained ankles and a lot of pain on the top of their feet. So they get midfoot arthrosis or midfoot arthritis in that top of the foot because the foot is really rigid and it's starting to form almost like arch that's rigid that doesn't move. As you walk, it should give a little bit. But with the cavus foot or with a very high arch type foot, as you walk and come down, it doesn't give. So people go heel to toe without giving a little bit. And that little give in the midfoot that should be there really causes severe pain in that arthritis because it wants to give a little bit of shock absorption, but it can't because it's so rigid and it's hitting bone on bone. And so what we try to do with those orthotics is just simply lessen that shock absorption and impact on that midfoot, as well as try to twist your ankle back in this direction so you're not walking so much on the outside part of your foot. So that's why the custom-made orthotics with somebody with flat feet or high arch type feet are usually highly recommended in the initial phases in order to prevent a lot of problems down the road. So as you can see, there's a lot of a variety, surprisingly enough, that comes into our office. There's a lot of, the foot is very intricate. There's a lot of bones, muscles, ligaments, and tendons that are affected, that are vitally important. A lot of pathology that I see with a lot of different disorders that can be very, very easy as well as very complicated and detailed that require a lot of treatment. What other things? Another thing that that commonly comes in as well sometimes is we see diabetic foot ulcers. It's more common nowadays. We see diabetics. And diabetics you see are associated a little bit with foot doctors simply because they have a lot of foot problems. Excuse me. One thing about diabetics is the simple fact that whenever you have diabetes, you get a lack of blood flow to your lower extremities. When you get a lack of blood flow, especially in the small little blood vessels that goes to the toes or the foot, you can end up getting a lack of perfusion to that foot. And that lack of perfusion or blood flow can cause a lot of problems. I've seen a lot of gangrene in my foot. Gangrene is when there's no more blood flow to the toes or the feet because the diabetes has affected the blood flow by decreasing the effectiveness of the circulation. And a lot of it starts in the heart. You know, you start to get a little bit of coronary artery disease, hypertension, a little bit of the underlying disease going on that decreases the blood flow to your extremities, and those are the first places that it usually presents. And I had somebody come in the emergency room the other day, and it had been 2 days, simply 2 days, and their whole forefoot, all 5 toes in their forefoot was black. It happened simply overnight. It wasn't something that it's something that can go quick. And so it's very important you keep an eye on things, you keep exercise, you keep diet, you keep all these things in mind so you don't end up sometimes with this gangrene. Another thing you see in diabetics is you get to a lack of sensation. You start to lose sensation called neuropathy. And neuropathy is simply just your nerves don't work. Your peripheral nervous system doesn't work properly, and so you get a lack of sensation. You can't feel anything. You can literally put your foot in hot water and you can't feel it. And I see it come in all the time. People walking on hot cement during the summer. They come in the next day, huge blisters formed up. They've been on the hot cement, haven't felt it, and then they end up getting a huge blister, which turns into an ulcer, which turns into an infection, which turns into an amputation, which sometimes even can turn into sepsis. So it can be very dangerous with a lot of diabetics because of lack of perfusion, which is lack of blood flow, as well as neuropathy. Another thing that you can get with diabetes, because your immune system isn't quite working as hard, you can get infections. Infection is common to see. Anything that's red, hot, or swollen, you should be concerned about, even if you're not diabetic. But if you got a red, hot, swollen, painful foot, you need to get in ASAP as soon as possible, because those infections can go quick. I've seen them go bad. People can get an abscess in their feet. People can get athlete's feet that's gone bad. And so the athlete's feet in between their toes can turn into infection, which in turn can turn into a bone infection, which can turn into amputation. So you just got to be careful, because what we try to do on our practice is it's called limb salvage. We try to save as many feet as possible. But when it comes down to it, and it comes to the point where it gets an infection in the bone, you really don't have a whole lot of choice if you get a bad infection in the bone. You either get 6 weeks IV antibiotics, or you get an amputation, and that's usually your only choices out there. And sometimes you have to cut off part of the foot to save the leg. And we have had to do that before. You know, people have lost their leg a couple of times, unfortunately. We've been able to save a lot, but yes, people have lost their leg because it's gone to a point where it's so bad that it's not salvageable. Other things. How about some questions? Any of you guys, any questions? I've been talking here for a little while. Maybe a few of you have a few questions about.
So we have one lady that couldn't be here, but she does jazzercise, and whenever she does it, it hurts the bottoms of her feet. So could that be something with her arches, or what might it be, or?
Yeah, that's a good question. Yeah, people that run or do exercise sometimes get heel pain or the pain in their ball of their feet. And it's usually because they're pounding on that part of their foot a little bit more. I see a lot of ballet dancers up on their toes. They get a lot of pain in their ball of their feet just because of that extra pressure where it needs to be. And sometimes it simply is just putting what's called a little pad underneath their foot to just cushion that underneath the ball of her foot. It's called a metatarsal pad. There's 5 metatarsal bones that make up the ball of the foot, and sometimes just putting a simple metatarsal pad just to cushion the impact can make a big difference for a lot of people. Sometimes people have underlying hammer toes, or have underlying where their toe sticks up a little bit more in the air. And they can get what's called a plantar plate tear and tear one of the ligaments on the bottom to where their toe sticks up in the air. And so that causes pain underneath the ball of their foot. You know, so there can be underlying things going on that's causing a lot of that pain. Sometimes you just need an injection, you need a pad, and that seems to make a big difference. Long term, sometimes an orthotic that goes in the shoe can really help make a big difference getting around long term of solving that problem. But it kind of depends on their foot structure, what's going on, the deformity. A lot of people that just have a normal, regular foot structure without any deformities, usually an orthotic or an over-the-counter insole or a pad can make a big difference for a lot of those people doing exercise on their feet. Anything else? Any other questions? Yeah.
So for me, when I'm at the gym, like the calf extension machines where you're sitting and like push outward or down, whatever with your feet.
Yeah.
If I use too heavy a weight, it actually like hurts my arches after a while. But that's the only movement if I'm working calves that does that. There just the ankle.
I stopped going to the gym.
You didn't need a degree for that one. Yeah, the certain position, if it bothers you in a certain position, don't do it. No, understandable. Yeah, it can be just stretching that muscle a little bit too much. You know, it's important to continue to exercise and important to do that stuff. Go to where it's pushing it a little bit, but not sharp pain. If it starts to get to the point where you're starting to notice it when you walk or doing other activity, then I get a little bit concerned. I think it's just mainly during that activity where you're just overexerting the muscle and the tendon, and so you just need to back off a little bit and gradually, or put less weight, and continue more repetition. It usually works pretty well.
I have twin 15-year-old boys.
Yeah.
And their feet freaking reek. I mean, like, you know, you've done the powder. Is there some type of, I mean, you could take that stuff and use it as chemical warfare.
So, yeah, that's a fun part of my job is you get these teenagers that come in and just keep your socks on.
It's terrible. I mean, we sit in the room like, what is that? And it's my son, and these shoes are on, and it still reeks.
Yeah, and that's a good question. Sometimes we see feet stink a lot because they sweat a lot too. So bacteria likes to grow in a moist environment. So if there's a lot, especially with teenagers going through hormonal changes, they're getting hormones, they sweat a little bit more than usual, and so they get what's called hyperhidrosis, which means excessive sweating, especially in their feet, surprisingly enough. Have a lot of pores there. It can sweat a lot, and then it can start stinking. So a couple suggestions. There is, vinegar soaks actually work pretty good for stinky feet. Take a half a cup of vinegar with a gallon of water, have them soak it each day, and it'll help get rid of a little bit of the smell. If they can do that, if it's the whole body, stick it in the bathtub. And no, I would just recommend doing that. I know, that's how. There are, and there's some different material type, a different wick material type of socks that'll make a big difference, but I'll go to that in 1 second. The vinegar soaks and hydrocortisone cream will work really well to kind of help to get rid of any kind of antifungal, and it's a steroid that brings down some of the pores, as well as an antifungal cream. So an antifungal cream will help make a big difference. Sometimes you have to treat the hyperhidrosis. I have to give a prescription to clog up those sweat glands so they don't sweat as much, and then they don't have that excessive stench to it. So sometimes there's just a quick medication you can call in for them for that excessive sweating that'll help with the vinegar soaps and seem to make a big difference. Of course, bleach your socks, bleach your showers, have them change their socks on a regular basis. I know that stuff is hard to do with teenagers, but other than that, I got some strong, powerful stuff that'll kill any smell in my office. So you want to bring them in, we can do it that way. Socks. He had mentioned socks. That's a very good.
I have a question about your plantar fasciitis you brought up at the beginning.
Yeah.
Like you were mentioning things that cause it, but if you are a runner or if you are pregnant or whatever reason, what are things you can do so you hopefully don't get it?
So they say stretching 70% of the time not only solves plantar fasciitis, but helps prevent it. So stretching, surprisingly enough, before exercise is really big. I usually send people to therapy because the therapist works them over. They stretch it like crazy. They get the inflammation down. They get the tendon not to become inflamed, or the ligament not to become inflamed again. And it makes a huge, big difference. But good shoes, insoles, and stretching is a huge key for plantar fasciitis. Custom-made orthotic, a New Balance Asics. I like TEDs, I like SASs for more of a dress style, but for running shoes, I like New Balance, I like Asics, I like Sauconys. A few of these other running shoes really make a big difference. Hoka's, there's always these new shoes that always come out that haven't tested and tried over time. It's hard to sometimes kind of give my opinion on these until they've tested a little bit over time to see how they last, see how they do. I haven't seen a lot of long-term results. Some things they're really good for. People with arthritis, they're really good for. Running, doing a lot of activity, or people on their feet, I probably wouldn't recommend those. As far as until studies come out further that might change.
So what brands did you say you recommend as far as dress shoes?
SAS, TEDs. There's some out there called a Dr. Comfort. There's another one called Keen's. Some of these are very high quality. Unfortunately, in shoes, you pay for what you get. You buy cheap shoes, they're not going to last long. They're not going to hold up as much, and they're not going to be as comfortable. But I definitely would get some of those brands. I don't know if you've heard of any of those Keens, SAS, TEDs. Those are really good. Seem to last a little bit longer.
So for the stretches, is it just kind of like stretching your foot out this way and up, or are there like certain?
Do you remember any? They stick you on a plank.
Oh, okay.
You can do toe curls. So you put a towel, you put a weight on the towel on the bottom, and you just crunch your toes together and move the weight closer to your foot.
If I do that though, it makes my like toes
Arch.
wanna, like cramp up and spaz out.
Yeah, sometimes it can be surprisingly enough if you get a lot of cramps.
While I'm doing it,
Yes, while you're doing it, gallon water.
it's not working.
That's what this doctor said. It's the gym that's the problem. No, stay in the gym. You should keep working out. No, if you do get a lot of cramping, you got to be careful because it can be dehydration. It can be a lack of sodium or potassium. You need Gatorade or some of those other supplements to really kind of, nutrients to really kind of help make a big difference. But I would, excuse me, I would for, plantar fasciitis, there's a few exercises that you can do. You can get a towel. Some people have a TheraBand. You get the towel, put it around your foot, pull back, and then push down. All right, you pull back with your foot and then push down, and when you pull with resistance, that'll kind of stretch that plantar fascia out. Another thing I tell people is get a frozen water bottle, 12, 16-ounce water bottle, put it in the freezer, and then once it's frozen, then roll it in your arch, kind of back and forth. At the end of the day, it seems to have two effects. One, it has the icing, and two, it has the massage. It seems to make a big difference for a lot of people. Some people use a tennis ball, a golf ball. There's different things people use that can help that as well. Some people touch your toes standing and sitting, or try to touch your toes standing and sitting. That can make that stretches out the Achilles tendon as well as the plantar fascia. Up turn around backwards on the end of a stairs with your ball your feet on the stairs with your heels off, and then go down and continue to go up. Up against the wall, stretching your Achilles tendon, pushing up against the wall. Those are a few things that they do in therapy. Some on your own, they teach you to do on your own that really can help that plantar fasciitis and can really make a big difference with that. Again, 70% of the time they say just stretching helps resolve that as well as prevent it. So plantar fasciitis is really good. Everybody usually gets plantar fasciitis. Has anybody had plantar fasciitis? See, he can testify. He knows. You'll know when you have it. It hurts. It hurts. I mean, even professional athletes have to sit out because of plantar fasciitis. Surprisingly enough, you'll hear, football players, basketball players on ESPN all the time, this player's out because of plantar fasciitis, He- They'll test your strength at physical therapy, see how tough you really are. So that's just some of the things.
Is it possible, like, to get, like, you have athlete's foot? Can it, like, spread to other parts of your body? Like,
Yeah.
if, like, another part of your body, like, touches, does that make sense, like that?
Yes, it is contagious. The reason athlete's feet is a fungus, and it's kind of like wrestlers when they get on the back of their head ringworm, or it's a fungus that can grow, that can spread, that can be contagious. I mean, they can't wrestle for a few weeks because it's contagious. It can be spread if you get touched and spread to other areas. And it's just a fungal infection that spreads. Fungus is just as bad as bacteria, and can sometimes be worse. I've seen it become very, very serious, and had to put on oral antifungals even to get it out because it's been so bad. Usually a fungus infection itches a lot. So if you know you got it's getting bad, it usually itches. Bad rash, it just itches everywhere, and you can't stop itching it. And so that's when you know it's starting to really get bad. It's gone to a point where it can get bad. So in order to prevent spreading, change bleach. Bleach kills everything. Lysol and bleach just kind of kill everything. You got to bleach your socks, bleach your showers. Try not to touch it. Use gloves, when you're putting it on, or use a cotton tip applicator when you're putting any of the cream on to kill it, so it doesn't spread to your hands or doesn't have any other problems. But it can be contagious. Any other questions? I think we've gone through a lot today, and so if that's it, I just honestly, I enjoy what I do. I see a lot of variety. There's a lot of stuff that comes in my office. If we can help you out with anything, we'd be glad to help you out. We're located next to the hospital. We're moving into that new building in the hospital, so we'll be located in there. We do a lot of people at the hospital know who we are. We've been here for 30 years. My father has, and I've just kind of been here for 9 years, and so we'd love to help out wherever. I appreciate your time and listening. Thanks.
Yeah, put it on the top floor, make people climb the stairs on their feet, right?
Have elevators in this unit.
But it's good stretching. Take
Yeah,
your shoes
good
off first,
exercise.
and then stretch.
That's why, ask him why he knows where's the balance. That's all Keith wears is new balance. Yeah, because he has way back. See, I have the power steps.
I don't have the power. Surprising enough, I play basketball. I do a lot of sports. These make a big difference if you do a lot of
This is a custom one?
These are all custom.
He also plays basketball against Aaron Hanks.
Oh, you know Aaron?
He works. Really? He just walked by and he said, I play basketball against him.
How much do these usually run?
Custom one?
Yeah, custom.
So over-the-counter ones are usually 50. Custom-made ones, insurance, we try to improve through insurance. If insurance doesn't cover them, worst case scenario, it's like $250. So they are a little bit expensive, but they last 3 to 5 years compared to the other ones.
What foot's your kind of fancy ice? What foot is it?
Both.
But I'm sure it's plantar fasciitis. I'm assuming it's, well, because my wife got it when she was pregnant.
Yeah.
And she stretched like multiple times a day, every day.
Yep.
And then she got a pair of those like dance go bombs.
Yep.
And that basically fixed it for her.
Good.
My sister has it, and hers is like excruciating. She's been stretching, and she's dropped the shock, and she said that would like kill like from pain down by like 30% for like 3 weeks. gonna inject breast. I don't know.